Have you ever been told that period pains are normal? Period pains are one of the most talked about period complaints. That's coiling up in bed, missing classes or work, or that's taking painkillers every month is part of being a woman. What if I told you that period pains isn't supposed to hurt that much? And if it does, there is an underlying medical condition that is hiding in between those pains in plain sight. Hi everyone, and welcome back to Good Life Diary on YouTube. Here we talk about fertility education and women's health in very simple terms. So if this is something you're interested in, please like this video, click on that subscribe button, and let's get started. So today we'll be talking about a topic that impacts millions and millions of women globally. What painful periods really are, the two different types of painful periods, we're discussing them right here today, plus the differences between them, the different causes of painful periods and what you can do to help yourself at home, the factors that can make you more liable to suffer painful period, and the diagnostic test to find this out in the laboratory. I will also let you know certain foods you need to avoid if you usually suffer painful periods, because it is completely not normal for your period to be so painful and cause you to cancel out all your day's activities. Let's get into it. So, painful periods, also known as dysmenorrhea. There are two different types of dysmenorrhea: primary dysmenorrhea and secondary dysmenorrhea. Primary dysmenorrhea, or primary kind of painful periods, is the type of period pain that arises without any form of pelvic disorder or pelvic abnormality. Everything seems to be perfectly fine in your pelvic area. Kind of pain begins just before your period starts or during your periods. It's a dull kind of pain that usually happens in the lower abdomen, though it can also be felt around the lower back as well as your thighs due to shared nerve pathways. Usually, this pain lasts for about 2 to 3 days, typically during the heaviest menstrual days. In primary dysmenorrhea, this pain is as a result of the release of a hormone called prostaglandins. Take note of this hormone because it's going to be very useful to us later on, because it forms the basis of most of the things we're going to be talking about today. This prostaglandin stimulates the uterus to contract and shed its lining, leading to cramps. Primary dysmenorrhea usually is more common among teenagers and in your early 20s. There are other factors that can cause primary dysmenorrhea, such as passing of period clots. The uterus has to contract and allow this clot to come out, so this can result in some form of cramps. I have a detailed video on this channel where I talked about the different causes of period clots. You need to know the size that is normal and the size that is a cause of concern, a cause of an underlying ailment. So if you do notice large blood clots or you didn't notice period clots at all, please, I advise you see that video for further guide. Other factors that may cause you to experience painful periods include being overweight or being obese, starting your period a bit earlier, being a smoker, or family history of heavy and painful periods, or that you don't have children just yet, because a lot of women have reported having started experiencing lesser painful periods just after having children. Let's now talk about the secondary kind of dysmenorrhea, that is secondary kind of painful period. Here, the cause of your painful period is due to an abnormality in the reproductive tract. There could be an abnormality with either the ovary, the fallopian tubes, or the uterus proper, because these are the parts that make up your female reproductive tract. This type of pain usually begins later on in life, usually after having experienced some years of pain-free periods, and it can start days before your period starts, gets worse when your period is here, and can continue even after your period has stopped. And this kind of pain can be more severe than that seen in primary dysmenorrhea. Is often associated with other symptoms, which include bloating, painful intercourse, bleeding in between periods, even pain during bowel movements and pain during urination, fatigue, difficulty getting pregnant, and some other symptoms as well. Early detection really matters. Let's now talk about some of the causes of this secondary dysmenorrhea. Number one is endometriosis. This is like the commonest cause of painful periods. It is quite common. It affects about 10% of women and girls of reproductive age. That is about 190 million women and girls globally. Here in endometriosis, tissues that are known to grow inside of the uterus now begins to grow outside of the uterus and can be found in tissues such as the ovaries, the fallopian tube, and some other surrounding organs around the reproductive tract. These tissues that grows outside the uterus, the worst part of it is that they equally respond to hormonal changes. They bleed, causing inflammations, and even as much as scar tissues. That is where these pains are coming from, because even these tissues, in as much as that they are not in the endometrium, wherever they are as well responding to hormonal changes, and they are bleeding. Symptoms of endometriosis include very severe menstrual cramps, painful sex, and difficulty getting pregnant, among some other symptoms. Another common cause of secondary dysmenorrhea, though not as common as endometriosis, is adenomyosis. Here also, tissues that are known to grow inside of the uterus, that is the endometrial lining, now grow deeper into the walls of the uterus, and they equally respond to hormonal changes every month, and they bleed inside of these uterine muscles, causing pains and severe inflammations. Some of the symptoms equally include difficulty getting pregnant, these severe menstrual cramps, amongst others. Other causes include pelvic inflammatory disorder. Pelvic inflammatory disorder is usually as a result of complications arising from certain things like untreated sexually transmitted infection. Here, infections that are supposed to be in the vagina now get the chance to spread up into the female reproductive tract, causing you to have pelvic inflammatory disorder. They can lead to severe menstrual cramps, difficulty getting pregnant, lower abdominal pains, bloating, amongst other symptoms. Other causes of painful periods include ovarian cysts, uterine fibroids. Fibroids are benign, non-cancerous growths that can happen in the uterus. There are so many kinds of fibroids depending on where they are growing inside of the uterus. Other causes include hormonal imbalances such as estrogen dominance and use of certain kind of contraceptives such as uterine copper IUDs. These may actually increase cramping. So what can you do to help yourself at home? Let us look at self-care remedies or home remedies that work, especially for mild to moderate kind of pain. Number one is heat application. Please, are you still here? Please help me like this video, subscribe to join this family, and keep watching. Heat application. A heat pad is like a hot water bottle that is usually placed around the lower abdominal region. This has been found to help to relax the muscles around there, suit you, and help you to ease cramps. But while doing this, make sure that the water bottle is not too hot and that the hot water is not making a direct contact with your skin, because this can offers some sort of permanent discoloration on the skin that is making direct contact with it. So it's better you place a soft towel or your clothes. The whole heating pad should be making direct contact with your clothes so that it doesn't get to discolor your skin. Okay. Also, certain positions have been seem to offer some sort of relief. Some women have reported that when the lie face down or the lie coiled up, it tends to ease their pains in a way. So if you discover that works for you too, please do it so that it can ease off some of this pain. Some other women have reported that anytime, any months they consume too much of sugary foods, that they tend to experience painful periods more. So limit the way you take sugary food, especially towards the start of your period. If you know your cycle, you know that your period is coming, you're going to be expecting your period soon. So start limiting the consumption of ice creams, start limiting the consumption of sweets and all of that so that you don't experience painful period for that month. Also, drinking warm water or warm tea baths have been known to offer some sort of relief. It has a way of kind of improving blood circulation and giving you a huge relief. So try that out. Also, mild exercise. I don't mean you should go hit the gym. I know you are in pains and I'm telling you to kind of start engaging in activities, but it doesn't have to be heavy exercises. Some floor exercises, yoga, walking, taking some light walks can help to speed up circulation, kind of make you more energized, and this blood will kind of leave your system and now offer you some relief. So supplements such as Vites has been known to help you regulate your menstrual cycle, assuming hormonal balance is the cause of your painful period. Also, there's a machine that is called Tins machine. This machine has been known to help to ease off labor pains for women who are in labor. It can help you to, even though there is no strong scientific evidence to back this claim up. And if you have tried some of these natural remedies and you're not getting any headway, you're not getting results, I think it is now the right time to speak with your doctor so that you can get some prescription medicines that are going to help you. There are also some NSAID drugs, that is some over-the-counter pain relief that you can get, and equally some prescription medicines that you can use to ease off some of these pains. Some of them include hormonal therapies, birth control pills, and some hormonal intrauterine device. This has been shown to significantly reduce period pain by releasing the hormone progestin. This progestin hormone kind of thins out the endometrial lining, reducing menstruation and even stopping menstruation entirely, and thereby reducing these painful episodes. And this treatment option is, of course, only valid if you do not have any business with pregnancy. Also, I want to talk about the surgical alternative, laparoscopy. This is especially beneficial for people who have endometriosis because this is very useful both in the diagnosis and treatment of endometriosis. So let's now look at the diagnosis. If your pains are persistent or getting worse, even after applying some of these self-care remedies mentioned herein, please don't wait, seek help. Laparoscopy is actually the gold standard for diagnosing this condition. It's a minimally invasive surgical procedure that uses a light tube with camera in it to look at and treat abnormalities in the lower abdomen and in the pelvis. So if your pains are not improving, please seek help. Early detection in most medical conditions could help save you a lot. Diagnostic procedures are ultrasound and magnetic resonance imaging. They are all methods of diagnosing this test. So this is how to begin your diagnostic journey. First of all, track your symptoms. All right, we've already said that some of these symptoms, some begin before your period, gets worse when your period is here, and even progresses. Are you equally having bleeding after sex, during sex, there is spotting in between period? You need to track your symptoms so that we can actually differentiate and know whether are we going to be looking at primary or secondary form of dysmenorrhea here. Okay, track your symptoms, know when the pain starts and know what helps. When does this pain get worse? These are some of the questions your doctor will ask you, so keep record of them. All right, so if these pains continue being persistent, see your doctor. He might likely request for an ultrasound as first line, or even a laparoscopy or MRI if need be. It's time to talk about some of the foods that you need to avoid if you do get painful periods, especially those associated with endometriosis, fibroids, or any other form of dysmenorrhea. Number one is refined sugars. This has a way of increasing inflammation and increasing the level of your prostaglandin hormones and makes these cramps even worse. This has a way of also in contributing to low energy levels, fatigue, and some other symptoms. Remember, we talked about this in my video of period blood clots and other weird period signs. All right, so as your period approaches, avoid pastries, avoid candy, avoid sugars and some sugary cereals so that your cramps don't get worse. Number two is dairy foods. This has been found to contain arachidonic acid that can further increase prostaglandin production. So as your period approaches, watch out for cheese, whole milk, and ice creams and some other dairy products. Okay, instead you can take yogurt. That's okay for you, because as there's more production of these prostaglandin hormones, your cramps are getting worse, and that's not what we want. Also, number three is red meat. They have been seen to contain saturated fat as well as omega-6 fatty acids, which encourages inflammation. Also, they contain arachidonic acid that encourages uterine contraction. So limits red meat, pork, beef, lamb, and even sausages. And if you must eat, you know the best time to stay clear as previously stated. Another is coffee. Cut down on too much coffees, black teas, chocolates, energy drinks. You don't need them. Another is processed and fried foods. They have been seen to contain high level of trans fats that encourages inflammation, and you don't need them. We're looking for ways to ease off your menstrual cramps. So anything that contains stimulants, things that stimulate your uterus to contract, arachidonic acid, prostaglandins, you limit them or avoid them. All right. Avoid or limit fast foods, instant noodles. If you have adenomyosis, if you have endometriosis, if you have fibroids, you don't need them at all. So limit or avoid alcohol is capable of disrupting your hormones and cause you to be fairly dehydrated in a way. So limit alcohol, especially if you're in this category I've mentioned previously. Of all these foods, focus on natural foods that can help you to balance your hormones and regulate your cycle, such as flaxseed and other. I have a video I'm releasing shortly on foods that can help you balance your hormone. Make sure you see that video when it's out. You need to see a doctor if your pain is intense or severe, is unpredictable, it comes, it goes, you can't really say when it's coming, and your period tends to make it worse. You don't have to self-diagnose or self-manage forever. You deserve to get the right kind of help. So seek medical attention. You will definitely get the right kind of help you need. Recap: the truth is that period pains is common, but it doesn't mean it's normal. So if you get this kind of pain that makes you to lose your relationship, to stop work, not to go to school, please, it is not normal. Seek help and seek it on time. All right. If you've been here up to this moment, please like this video. I have to say again, subscribe to join this family and make sure you share it. A whole lot of people, women, are in need of a video like this. And if you have any questions or your thoughts, or is there anything that worked for you, feel free to share it in the comment section, and I will attend to the question, and someone might benefit from what you're going to be dropping. And I'll see you in my next video. Thank you so much for watching.